All right, girl. Well, gonna start this thing then.
Okay.
Welcome to Tip Talks. This is a more serious episode, but we're still gonna have fun
Let's get started.
because I can't do anything in life without laughing, without having fun. So we're gonna talk about a serious topic. I've got LeeAnn here. She is a trauma therapist, and we have been trying to get together for 2 months. Literally 2 months. Because you got, wait a minute, did I get COVID first and then you got COVID? Or we weren't going to record until after I had already had COVID, right? And then you got COVID?
I had COVID. Yeah, I started getting sick on Super Bowl Sunday, so I think you had it first.
I did. I did.
But we didn't
sadly.
get it from each other.
No, we didn't even see each other in person.
No.
We'd only talked on the phone, so you can't get it that way.
Right.
But so then all these things just kept happening, and then I got so sick, and you can still hear it in my voice a little bit. But so now we're finally together.
I know. Welcome back.
I know. You know, it's like welcome back and welcome to the studio. So we're going to talk about a couple different things today. One about trauma therapy and her experience in becoming a therapist, and especially one that specializes in trauma. And then what other facets do you focus in again? So we have trauma.
You mean mental health wise?
Yes.
So I treat serious mental illness. I have a specialty in bipolar disorder. I also work with women going through postpartum issues.
Oh.
And
That's nice. That's good to know.
Life transitions. So
Okay.
I do a little bit of everything there.
Yeah.
But
I didn't even know that. That's something new
those are
today.
my specialties in dual diagnosis.
Oh, okay. What does that mean?
Dual diagnosis is when a person has a co-occurring mental health and substance use issue.
Oh, so like if you have a mental health issue, but then like you're addicted to a substance?
Correct.
I think that's probably pretty common, huh?
Oh, yeah. So when I was in school to be a therapist, I made this mistake of telling my teacher, well, it wasn't a mistake, actually. It was a good thing. But I told my teacher one day, I was like, I'm not going to work with people who have substance abuse issues because my brother, I grew up with, my brother had substance abuse issues. And I just was like, I've been there, done that. I don't want to do that.
Yeah, you're like, I don't want to do that.
And my teacher was like, well, good luck with that, LeeAnn. And
Good luck.
And I think I had that conversation with two of my professors, and they were both like, good luck. And, the statistic for years has been over 60% of people who need mental health treatment or are mentally ill have substance use issues. And we don't even know that that's an accurate statistic. So, but that's a pretty high statistic.
Yeah.
So fortunately,
Yeah.
I was past the age of knowing everything, and I was like, well, maybe I should learn about this so that I can treat people. So it became one of my focus areas of study, my main focus area of study. And then by default, when you treat people who have dual diagnoses, you run into people who have a lot of trauma.
Yeah, right. Because you're like trying to self-medicate, I think is what happens. Because, I specifically know people who tried to medicate away the trauma, basically. So it's like to try to erase it, to try to live a different life, and just creates so many more issues. But, you only know what you know.
Right. Well, and I mean, it does on the short term, take care of some things like intrusive memories and things like that. But unfortunately, what happens is it doesn't make it go away.
Right.
And so then maybe years later when you try to get sober or clean or whatever it is, you have this period of it just flooding back to you.
Oof.
And I always refer to that as an emotional flood after, we've closed the storm gates. And it can be very difficult to manage,
Yeah, I can only imagine because I just recently learned, I want to say in the last year or two about flooding. I had no idea that was a thing. And it's a great description of what happens when you're having emotions or when you're having feelings or things that you can't control because it literally is like a tsunami. Yeah. So you have to come up with words so my husband and I would have to come up with words like Antarctica, ceasefire, Antarctica.
So you're doing your own cognitive restructuring there. So
we were taught by a therapist.
Yeah, good. So, but so that's one thing as a therapist I look at when we're dealing with trauma is always to give people coping strategies first because it's, in my eyes, it's just not fair to open up that whole can of worms and expect them, because they're going to start having possibly nightmares or, with these intrusive thoughts and memories and things like that. And it's just not fair
Yeah.
to not give somebody coping strategies first.
Yeah, that makes a lot of sense.
Mm-hmm.
Like, here's a abbreviated playbook for you to use as we gain time together and
Yes.
work through this. It's like, you know, you can't go and play football without a playbook, and you can't go learn baseball without understanding some of the components. So I think that makes a lot of sense.
Sure.
And I never even considered any of that. And I don't think that this is my opinion, but I don't think all therapists are created equal, because I don't think everyone does that. And you don't really know until you have a good therapist that those types of things are really helpful or that they're necessary, because I've seen quite a few therapists, and I had even told you about my current therapist, how she kind of like freaking body slammed me like the first time I met her, and I was like, holy shit. And then I had to like
WWE.
right. Literally, it felt like WWE. I was like on the couch for 2 hours, but she's like an amazing therapist. But then, you know, once I told her what that experience did to me, then she was like, oh, okay, let me reel it back in, and then let's kind of get a playbook together of how we're going to handle things. And it like worked out really well. But I don't think everybody has that experience. And then like, also I think people can find therapists that more just like become a cheerleader and don't really help them work through problems. And then they just come in and they just sit there and bullshit, or they just come in and don't really, work on any of the issues that the person has. And so then the rest of society, or people who have reasons why they don't go see a therapist, they always use those reasons. Well, so-and-so went and saw a therapist, and I didn't see any difference in their blah, blah, blah.
Right.
You know what I mean? And
right.
You're like, oh my God. So I do kind of, before we start diving into your specialties, I'm kind of curious, what tips and advice do you have for people looking for a therapist who don't know how to start? Because I will tell you, I went through this with my son, and it was very challenging. So I would be kind of curious what your advice would be.
Well, and this is a story I hear oftentimes is, people will come in and they'll say, I went to this therapist and all they said was, okay, tell me more about that. And that was it. And I'm like, oh, well, that's not me at all. I'm going to tell you things, and I promise I'm always going to be honest and truthful with you. And, as a therapist, that's our very first goal, is to get in there and to build a trusting rapport with you. So if you're looking for a therapist, one of the things that you can remember is you can always call and have a 15-minute consultation free on the phone.
Oh, I didn't know that.
Yeah, to see if, maybe you match
vibe.
up. If you vibe well together. And so that is always a good route
I
to
didn't
go.
know that.
A lot of people do. Some therapists don't offer it.
Yeah, they should,
but
though.
most do.
I mean, why would you want to have a client that you like don't think you can help, or that like they just grate on your nerves? I think it's a two-way street. Like, you really need to like work well together, because if the therapist, you know what I mean? Like, I don't know. That's just my personal opinion.
No, that's fair, because as a therapist, you can't do everything, like every other profession, there are good nurses and mediocre nurses, and then there are great nurses, and so you're going to find that in every field. So you just have to go find somebody who vibes well with you, who you feel like you can trust. If you don't feel, one of the things I always do with clients is, see how they feel like they're doing. And is this working for you? Because every coping tool I teach you may not work for you. You might hate one of them. And I want to know that, because if you hate it, you're not going to use it.
True story.
Right?
And it's like just wasted energy.
Right. And so then we need to look at something else, or we need to shape it a little bit so that it does work for you, Or maybe you just need to do it at a different time of day. Or a lot of times people will come in and they'll say, I went to this other therapist and they just want me to breathe. And I'm like, well, I'm going to want you to breathe too. And do you know why they want you to breathe? And they say no. And I'm like, well, when you do deep breathing exercises like
Makes me want to breathe.
Huh?
I said it made me want to breathe.
Oh, yeah. In through the nose, Tiffany. In through the nose and out through the mouth. But when you do deep breathing exercises like that, it actually pushes oxygen up to the brain, causes a chemical reaction in the brain, helps the emotional part of the brain calm down, and the logical part of the brain be more accessible. So we can think more logically. So we can calm our own nervous system down, So as far as I don't know exactly how you know if a therapist knows all they need to know.
Sure.
I mean, because you're at a little bit of a disadvantage. Most people who come into therapy have either never been to therapy
Sure.
before, or they just, I mean, it's really up to us to lead,
Yeah.
right, as the therapist. So, but if you're ever feeling uncomfortable, you know, after you've seen a person once or twice and you just don't want to go back, I would encourage you to talk to them about that. And like, if you're talking to me about that and I just go, you know, you're saying, oh, you know, by the way, I have this eating disorder and I really need to approach that. I don't treat eating disorders, and I don't want to practice outside of my scope. It would be
That's what I was going to ask you. So, someone, I just had an author on about eating disorders specifically.
Oh, yeah?
And I asked her, I said, from her experience, what did she recommend for people who think, wow, after watching this, I think maybe I might have disordered eating or have an eating disorder and I never really recognized or acknowledged it. You know, how do you recommend them going and finding help? And so she kind of walked me through that. But she also said what I thought was really interesting, and I wonder what you think about this, is finding a therapist. At first she said find a therapist that specializes in eating disorders. And then she said, well, that might be challenging. So find a therapist that works with addictions, because if you think about it, eating disorders, drug addictions, they're different, but they all are kind of in the same vein where it's like something that you have to live with, that you have to figure out how to deal with.
correct.
The difference with eating disorders and drug addictions is that you can't abstain from food, but
Right.
like it's still an addiction. And I think that's interesting. So do you feel like therapists choose fields that maybe they have experience in because it helps them help the people that they're working with?
Most definitely. I mean,
Fascinating.
it's just like, you know, I was telling you earlier that I wasn't going to work with people with addictions, right?
Yeah,
And
right.
my teachers were like, "Good luck.
Good
you know?
luck.
You won't be working with anyone, basically."
Right.
And so then I went, okay, I need to educate myself on this, you know. But I don't fully agree with finding an addiction specialist for treating eating disorders. I think it depends on the eating disorder.
Yeah.
So if it's anorexia or bulimia, addictions counseling isn't really going to work well for me in that area. But if, you know, we're talking about someone who has an overeating problem, you know, things like that, addictions therapy is going to apply more.
Interesting.
Right.
That's an interesting.
So, or addiction style. We don't really do
Is that
addiction therapy. So,
Well, yeah, because one's like really abstaining
right.
and starving yourself of or avoiding, and one is, you know, overindulging, which is what, you know, alcohol and drugs usually typically fall in. So I guess I can kind of see that.
Yes, but you can also utilize a harm reduction model, even if it's, I mean, we don't usually use that with hardcore drugs, like you wouldn't be a heroin addict and somebody use a harm reduction model with you. Like they actually do use harm reduction models of, you know, clean needles. That's a harm reduction,
Interesting.
right? But you wouldn't use a harm reduction like some people might drink too much and then they want to learn how to drink socially.
Oh, okay.
Now-
Because they're not necessarily an alcoholic.
Right.
So that would be where I would say I lived. Back to the social drinking versus like just maybe overconsumption, but not really identifying or being categorically an alcoholic. That is kind of the lane that I lived in for a long time. And I think it was me trying to self-medicate the ADHD.
Sure.
And it wasn't really until I started treating the ADHD, that I kind of realized like what I was doing. And that really, really helped, you know. And so I
sure.
would see how what you were saying, like if someone comes in for one thing, to see a therapist, and then you kind of find out and identify. Is there ever a situation like where you start seeing someone, and maybe not in your circumstance because you're so versed in some of these things, but like if a person sees a therapist and then they identify that they have like PTSD or something that therapist doesn't really deal with, to switch therapists to one that does?
Yes. And so oftentimes the therapist will refer out. And so I'm actually in some online therapy groups that are referral groups, and we will even look for people within that group. Look for another therapist to help them out. Another useful tool for people is the Psychology Today website. Most therapists, not all, have a profile on it.
So you're seeing a therapist, they find out that it's not working, or not working, but like that you have some identified things now that they don't handle. So do you quit seeing that therapist altogether and then you have to switch to a new therapist, or do you like kind of see both of them and then switch over?
It depends. Usually a therapist should help you transition away from them and into that other therapist. Now, let's say it's something like, I don't do EMDR. But other trauma therapists do.
Yeah.
And so someone might go to another therapist to do EMDR briefly, or, well, depending on how long it takes, and then they might return to you.
Interesting.
So it really depends on what the person needs
All right.
in the situation.
Well, I'm going to use my own personal experience to kind of like have you guide me for other people.
Sure.
So I've seen therapists historically through my life, but just at different times for different things. And never did like my ADHD come up, never did, any trauma come up, never did anything come up. Now, I did see a therapist once, and that one was like in 13 or 14. And she was very supportive in like some of the energetic situations that I believe in, like, energy and the universe and, people and all those types of things. And that I really appreciated. But again, we didn't really work on anything or identify anything at that time. And then fast forward to my husband getting therapy and then us seeing a joint therapist, which was amazing. I think if anybody's having any marital issues, they should definitely see a therapist together. It is like the best thing because people come together. We have our perceived perceptions of what is like right. And then you have the third party that comes in who's completely non-biased.
Right.
And then they can say, whoa, you, and they can kind of bring you in. And I think that was the most beneficial thing ever for our marriage. And then she's the one who referred out for individual basis, which I thought was really helpful. And that's how I found my therapist. Fast forward, meet my therapist, have them knock me on my WWE ass. Where I was like, whoa, girl.
At least it wasn't a pile driver.
Right. And then, finding out, she looks at me and she goes, have you ever been diagnosed with anything? And I was like, oh, Jesus, what is she going to tell me? Freaking out like, oh God, here it comes. Here comes the hammer, other than like the ADHD thing, which was very obvious. She's like, you have complex PTSD. And I was like, whoa, what? Why? Like, why would I have complex PTSD?
Right.
It's kind of like you said, where you work with people and then people just assume because they weren't abused, they weren't maybe, had a horrible thing happen to them. They weren't an addict or no one died or whatever. Like they just assume that they have no trauma. Right. And you can't really assume that, can you? Because like if you're a child, you process things so differently.
You do, most definitely. And sometimes trauma can be what you did not receive.
Oh, and I never knew that.
Yeah, I mean, if somebody's not meeting your basic needs, or even if we go beyond the basic needs, if your emotional needs are not met as a child, that can manifest as trauma later.
Woof. That's a
yeah.
lot, especially when I have older kids. I'm like, oh my God, how did I screw you up when I was 20 years old? I have no idea. You know what I mean?
But I want to go back for a second.
Yeah.
So there are some therapists are trained clinically and other therapists are not. Okay. And so when you're trained clinically, that means that you are trained on the diagnostic criteria in the DSM, the Diagnostics and Statistics Manual that we diagnose from. Okay. So when I was in school, we had at that time 3 different tracks. There was a child and family track. There was an administrative track, and then there was a clinical mental health track.
Oh, okay.
Okay, so technically, we are all eligible for the same board licensure after we graduate from that program. But I will tell you, people who did not study the clinical information are going to have a very difficult time taking that state board exam.
Oh, okay.
So, and after I became a therapist, I actually met another therapist who wasn't good at diagnosing, and I just thought, well, how can she not know this stuff? And that was kind of I had been with all these therapists who also studied clinical information, right? So, and not really exposed to the other
Yeah.
You know?
Oh, so that would explain why some people wouldn't identify that in me is what you're saying.
Right.
Now, is there a designation like after your name, like doctors that tell you these things?
No. In some states, a license will differentiate. It'll be a licensed clinical. I'm a social worker, so it'll be a licensed clinical social worker, or in Ohio, it's just a licensed independent social worker. So.
Things I never
you
know.
really have to ask, I think, if that is something that, you're interested in. So, I mean, I've had a lot of people come to me and they've been misdiagnosed for years, or they've not been diagnosed, or one day I look at them. ADHD is one that comes up often, and I'm like, has anyone ever screened you for ADHD? Like, has that ever come up in your background? And most of the time people will say no. And so I'm like, yeah, we better keep an eye on that. We better look for that. Or people will oftentimes be misdiagnosed with bipolar disorder. They'll be diagnosed as depression. And
Interesting.
well, so when I used to work in the psychiatric ER that we have here in Cincinnati, it was one of my internships when I was in grad school. And our main job in there is to assess people, right?
Yeah.
Figure out what's going on. And then, the doc sees them also. And we come up with a plan. Doc usually starts them on a medication. And we decide whether to admit them or if they can be released, and we develop some kind of, release plan with them.
How can you assess something in such a small window like that?
Well, that's what I was going to say. I know that we misdiagnose in that place because so many people with bipolar disorder present when they're depressed, because that's when the symptoms are really unbearable. I mean, that can also happen in mania, but we just don't see people coming in as much with mania. It happens, but when people start having those suicidal ideations and those very serious symptoms like that, that's when we're seeing them present in the psychiatric ER. And so that leads you to go, okay, this person's experiencing depression, but really they're experiencing the depression that's happening with a bipolar disorder. Wow. That's a different medication than if you have major depressive disorder,
Wow.
Not completely different, but typically if you put a person who has bipolar disorder on an antidepressant alone, it will send them into a mania.
Oh, my God.
So, and you have to have started a mood stabilizer first for a person who is bipolar. Then they might also take an antidepressant.
Interesting.
But they should never be taking an antidepressant alone. Same goes for ADHD medicine. If a person has bipolar disorder or any kind of psychosis, and psychosis does not always come with bipolar disorder, but also can come obviously with other disorders, anything on the schizophrenia spectrum. And,
that one terrifies me because I was exposed
Sure.
to someone in my 20s who had that.
Oh, really?
Who lived like on their own, and they tortured me, like literally, like because I didn't know what was wrong with them. I just knew something wasn't right, and they would present childlike with their other neighbors who they were with their kids all the time, and then like act like a teenager, and then be like very aggressive towards me because they didn't agree with my lifestyle, and I lived underneath them. I had to move buildings.
Oh, wow.
It was horrible.
Yeah, it can be. And I mean, definitely untreated psychosis can be very scary.
And you don't even know, if someone's untreated or someone is treated, and like how do they manage their medications? I mean, there's a lot of invisible things out there in the world, and
There sure are.
that like comorbidity is terrifying to me on some level, mostly because of my PTSD and the need for safety.
Right,
You know what I
right.
mean? Like, so my own world is like, I just need to be safe, So it's just interesting to think about all these things and think about the people and, the whole thing with the bipolar, mania, depression, that is, wow, that kind of just blew my mind.
Did it?
Thinking about, a little bit, because, you think about a lot of your friends who are, or even family members maybe who are like, have talked about where they've been in their life and having those moments, and then thinking, oh my gosh, is that person struggling with bipolar and they don't even know because they don't have like a proper diagnosis or they don't have the right medications. And you think about people whose medications don't work for them and they even say that. It just makes my brain because I've nicknamed myself the asshole or the question queen. So then my brain's like, questions. I have so many questions.
Okay. It's okay.
And then I'm like,
I hope I have enough answers.
no, you're amazing. So you back to like the person may not realize that they have trauma or realize that they have experienced something that has been traumatic for them. How do you work through that? Because you are specifically licensed and capable and specialize in those areas, right?
Yes.
So what is just a brief, you give them the playbook, you said. So you give them the coping skills.
And then the other really important thing to start off with is to help them develop some safety in their life.
Mm-hmm.
Okay.
Yeah.
And so, oftentimes, especially if we have trauma in the past, okay, we want to look at how that broke down your safety and how that you have reestablished that safety as you've either grown up or changed your life and most people don't think about safety. If I just say to you, what's the safety in your life? You're like, I don't know.
You maybe like don't even think about it, but then you do things to try to create that safety.
Right.
Like either being like super vigilant, super guarded. I think everybody has different coping skills, and that was what I would love you to touch at, like on how people develop coping skills, and sometimes those coping skills might be good, and sometimes they might not be. So, like, you probably have to work through all that stuff with them too, right?
Well, sure you do, but I want to say something else about safety real
please,
quick.
yeah.
So, quite a few years ago, I was having a really tough week in my life. My mom was on life support.
Right.
My dad was in hospice.
Oh, God.
And to make it even simpler, they were in separate cities. So,
Oh my gosh.
yeah, my dad was in Dayton. My mom was here in Cincinnati. They were divorced at that time.
Right.
And so, and I had 2 little kids, and I was working part-time. I was married then, and so I had a lot going on, and then I was responsible for my mom's care and everything. I was not solely in charge of my dad's care, so that was helpful in that situation. But oftentimes when I get into situations like that, I go, okay, your safety is shaken, because those are my parents. That's where we get a lot of our safety, from the time we're born and the entire time we're growing up, right? And even as adults, they're always there, and hopefully. And,
true story.
So I thought, okay, my safety is shaken. What would I tell myself if I was sitting on my couch?
Oh my God, I love you. What would I tell myself if I weren't me?
Yeah. And so I'm like, okay, self-care. And so I started doing, oftentimes I'll practice the exercises that I give to people to do, right?
magic.
Because, I need to know how they work, right?
Right. I love this.
And I can benefit from them too,
Yeah.
And so I thought, okay, I'm going to walk through my life and really focus on safety. And what I have here is safety. And I used to have people make a list of what all they thought
I'm a list girl.
Yeah. But I've gotten away from the list because of this particular thing.
Okay,
the
tell
list
me.
is fine. Okay.
Right.
But in this exercise, I don't like the list alone, because I thought I'm not going to make a list of this, because I just know myself. And,
Right.
And so as I'm walking through the day, I'm trying to take these moments and observe, where do I feel safety right now and why? And so I noticed I'm tucking my daughters in for bed, and, you tuck them in and then you go back and check on them later.
Yeah.
Well, I'm looking at my little toddler there, laying in bed asleep, and I'm like, I feel incredibly safe in this moment. And why do I feel safe? Because, see, that's not something I would have written down.
Right.
Okay. And that's why what made me get away from the list.
Okay.
So, because I thought, okay, I feel incredibly safe right now because we provide a nice home for our children, for ourselves too. But, we don't have to worry about where we're going to sleep at night, when our next meal's going to come. They're nice and safe and snug in their bed. We feel loved. All of those things give us safety in the world. But again, it's not something I would have written down on my list. So,
yeah, but I think maybe for someone who's not as in tune to their, like, I feel like some people, I had no idea that everyone wasn't like me.
most people don't. It's called projection.
I was like, well, surely everyone's looking into their deep selves and doing self-reflections.
Oh, no.
Oh, no. No, they're not.
No, they're not.
Oh, surely everyone wants to be a better person. Surely. No, they do not. So, yeah. But also, I don't know, like, when I hear you say that, my brain is spastic. And it's like, oh, but I was trained to always worry. So, like, I would have that moment And then the intrusive thoughts would come where I would be like, oh, this is such a wonderful moment. But what if something happened? What if this happened? What if this bad thing happened? Oh, no, now I have to worry. And then I create these compulsive habits when I go to bed where I have to like check the cameras. I have to do this. I have like a systematic, almost OCD thing that I would do. And I go in and out of those, like depending on the amount of stress in my life. So it's kind of funny listening to you say that. I'm like, oh, Lord. Lord,
so
Jesus, help me.
That would be something in therapy that we would identify, right?
Yeah.
And you've already identified it. And then we would put some strategies in place because first you have to recognize that you're doing it, right? And then you have to go, okay, what can I do to manage this? And we would strategize for what kind of coping skill would help you manage this. Then we'd let you go practice that. So because obviously the idea would be you have no reason to worry in that moment.
I
right?
know. But then you can create, just like anybody, you can create reasons to worry. So I've tried to really change my focus. So like I've had a really rough start to the year, for example, just to use trying to flip the switch, because what I found that I have been doing is explaining to everyone why I have been MIA or why I have been not myself. And so by focusing on all the bad things that happened to me this year and like trying to focus on coming out of that, I'm still focusing on the bad things that happened to me this year.
Yeah.
And I really don't want to do that. And so I'm like walking around like, why do I feel bad? Well, you have to acknowledge these bad things happened to you, but then you have to flip what you're focused on. And you have to find some kind of positive thing. So one of my girlfriends and I started this thing every day. We're going to find like certain things during the day that we're grateful for. So that way we can switch our brain into thinking about seeing the bright spots versus seeing those bad things that have happened. Because I think when you're in a dark place, anyone and everyone can like really only see the dark spots that they're like dealing with, right?
Sure. Well, anxiety feeds anxiety. Negative thoughts feed negative thoughts. See the pattern, right? And so we have to figure out where we can flip that around. And it's cognitive restructuring.
Cognitive restructuring. I like that.
Where we're going to go in and we're going to look at, okay, these are your negative thought processes and how can we change those to, and we don't always want to change them just to what's positive.
Right,
because people don't always buy that, like they're like, that was a lot of bull.
That's a lot of woo-woo bullshit.
Right, exactly. That is exactly right. And so,
I'm here for the woo-woo. Sign me up for the woo-woo, please. I need the woo-woo.
There's actually a book called "Stop Telling Yourself That Bullshit," and it's
I
all
love
about
that
this.
so much.
I
don't know. Would that be a Debbie Downer for me?
No, it's really great. I mean, because it talks about, when you when you tell yourself negative things all the time, guess what? You're going to talk negatively to
okay.
yourself.
So it's talking about quit telling yourself that bullshit that's like negative, and then like start telling yourself good stuff.
Well, the really positive stuff, like if you're going to be Susie Sunshine all the time, like that can be bullshit too.
That's what I mean. Like, that's what I thought you were doing to me, because like I tend to be like the person who's like always trying to find that like silver lining somewhere. It keeps me going, because otherwise I would just fall into like a puddle of despair, and then like I would not want to be there. Yeah. You know what I mean? Long term. It does happen to everybody.
Yeah, it does. But what we find really works better is to be realistic about it.
Wait a minute. Just because it's true, is that okay? So I'm always getting told, Tiffany, just because it's true doesn't mean you need to say it. I'm like, well,
that is true.
Sometimes the truth hurts, dude. Well, because I don't always filter out the truth. Like I'll just be like blah 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 blah, and it's like the truth, and it's like not Susie Sunshine, it's not Debbie Downer, it's just facts. This is hard, LeeAnn.
I guess it
God
depends
dang
on
it,
the
this is hard.
But that's ADHD coming in there, So for a lot of women, we see that as, we speak before we're thinking, or too much comes out, or I'm overly talkative, So it's great that we're both here together with ADHD and, doing this.
I feel understood. Although when you see some like if I'm in like a feral moment with... I don't know. I think I'm really confusing for most people. So
I got you.
I know. I'm so glad, because I think I'm just really weird, and it's fine. It's cool. I'm here for it. The thing with ADHD and, just spitting out things, or like feeling the need to like jump in and say it or like get it out. I don't know. some people don't have that in their ADHD, and it's like weird to me, or ADD or whatever it is.
They don't, so a lot of my self-narrative is stop talking, LeeAnn. LeeAnn, shut up. And I'm not being mean to myself when I say shut up. Like, it's kind of a playful thing I do in my head, right? Because I don't want to talk. Most people do talk very negatively to themselves.
I know. Oh my God. Let's have this moment real quick.
Yeah.
That I had when I watched this video, and it was like, okay, I want you to sit here and I want you to like be quiet. And then the person tells you, let's just say, tell yourself you're beautiful. So, and don't say any words. You are beautiful. And you sit there and say, in your mind, you're beautiful. Okay. 1, 2, 3. Okay, great. Now, who was talking to you? No one was talking to you, but you heard it, didn't you? You heard your own voice. It goes to show you the power of the silent voice in your head, what it is doing to you all day long. I was like, I have goosebumps even thinking about it. Because how many of us just sit there in this weirdo, like negative self-talk, like, oh, that person probably doesn't like me, or oh, that person probably thinks I'm too much, or oh, that person's probably judging me, or does that person think I'm fat?
Here's the reality. That person's probably not even thinking about you.
And they don't even give a shit. And even if they do give a shit, let them give a shit. Who cares, you know? But I just think that's so powerful, because why are you going to spend all that time talking negative about yourself and not loving yourself?
Right.
When you are the only you, you were meant to interact with all the people that you did. You have a divine purpose, no matter what has happened to you. You know what I mean? So I don't know. I don't know. I just feel like we need to like empower and fire up that part of our brains more.
Sure. We definitely do. My dad used to say, wherever you go, there you are.
I love it.
Right?
That's so smart.
And I grew up
I love that you have that.
I know. I grew up hearing that a lot.
I never heard those types of things. It was,
no,
you will reap the consequences of your choices.
Well,
okay,
I
Dad.
heard that too. But I also heard, LeeAnn, if your head wasn't attached to your body, you'd lose it. Because no one had identified that I had ADHD at that time.
Same girl, same.
Yeah, well, they didn't diagnose little girls with that
I
then,
know.
typically, and unless we were, on the more severe end of that spectrum, it went unnoticed.
Yeah.
But
or if you could get good grades,
right, and I could,
or if you could like be likable enough, and if you were trained to be a good girl and be nice and be polite and sit tight, and even if you couldn't sit tight, they would exercise grace because you were so nice and polite.
Right.
Yeah. Oh, girl, the whole thing. That just feeds into so many things, though. I mean, being a woman, I've had this conversation with someone recently. I think it was Annie. You'll have to watch that one. Annie was just nominated as the Citizen of the Year in Anderson. She's an amazing human. She's an attorney, and she works at the chamber. And I've been so lucky to meet her, just like I met you through Rick. I just feel so like grateful to the universe, bringing so many amazing people in my lifetime to me, that I get the joy of knowing them on such a better level. And it was so funny because, just quick offbeat ADHD, I'll just pre-disclose that. Like, just thinking about how you and I met, and Rick was like, you need to meet LeeAnn. She's really cool. And just like how, I know, right? How your perception of, you can't really take someone in by pictures or by what they do, because my first immediate concern was like, oh my gosh, is she going to be like a really dry person because she's a therapist? Is she going to be like not relatable because she's a therapist? Or is she, I didn't know. So I came into it very cautious. And then within 10 minutes on the phone with you, I was like, oh, this chick's cool. I was like, she's amazing, and I love her.
We are sisters from somewhere in the universe.
It was so wild. But do you believe in that? Like, the universe brings people into your world?
I totally believe in that. Sometimes we just have to open our eyes and see what the universe is giving us. Sometimes we miss it.
Yeah, I agree.
And we can miss it if we're not paying attention. So I don't know who's really in charge of that.
Right, same.
I mean, and it could. I don't know. But yeah, I do believe that the universe gives us what we need. And sometimes we don't even like what it gives us.
Oh,
and,
right.
Maybe that's an opportunity to learn or something like that, But
you're like, dang it. I really don't want to learn right now. Thank you very much, universe.
Right. I did not ask for that.
Right.
And it's like, but you need it. So,
yeah. It's kind of like, I always felt like every time I would get sick, it was like because the universe was like, I told you to slow down.
Oh,
I told
right.
you need to chill your jets. And I was like, nah, dog, I got this. Like, what are you talking about?
It's like, no, you don't.
No, guess what? Wham!
Body slam. That seems to be a theme in your life. Yeah.
Why? Because I refuse to listen. I am very obstinate. Are you like rebellious and obstinate in certain ways?
Totally.
Yeah.
Yeah.
It's like, no, I'm the go-go girl. You don't tell me what to do. Go, go,
Right.
go. Whap! Like right into the wall.
But I've kind of learned over the years to kind of harness in some of that rebellion so I can use it in a positive way.
Yeah, same.
You know, and so I do want to go back to positive self-talk there for a
Yes,
minute. And,
please.
Or negative
I
self-talk,
love that she can
really.
redirect me. It's so great. I need that in my
That's
life.
something else I've practiced over the years. So.
She's-
But
We're restructuring this conversation, Tiffany, real quick. Let's go back to. I'm just kidding. Go ahead.
but now I forgot what I was going to say.
I did it again. Wham!
So when people have that negative self-talk going
Yeah.
on, you know, I usually will give them an exercise where I say, okay, I want you to pretend that your best friend did whatever it was, failed the test, okay? And the messages that you're giving yourself in your head, I want you to say to your best friend. Because those messages usually are something like, I'm stupid, I don't know what I'm doing,
I know,
I
right?
can't even learn.
Oh, I hate that. It makes me so sad.
Right?
But some people don't even realize they do it, like myself. But then
Right.
I see my kids do it, and I'm like, don't do that.
Yes. Well, and then I say, okay, so say to your best friend what you're saying. And they're like, no. And I'm like, why not? And usually, you know, it's mean. And I'm like, yeah, it is mean. It's mean to call yourself stupid too. And why do we feel like it's okay to be mean to ourselves? You know?
Oh, I love you.
And
You're
that's a
amazing.
whole different way of looking at it, isn't it? You know, because I could fail the test and go, okay, well, I know I'm not stupid. These things in
Right.
my life have shown me that I'm not stupid, but I didn't do what I needed to do here.
Right.
And so I do need to go back and fix something.
Yeah.
Now I'm going to learn from that. Whereas if I'm just stupid, I don't know what to do with that. I'm just stupid. Like, what do you
Hey,
do with
we
that?
all have our
You know?
strengths and our weaknesses,
Sure.
and we cannot be strong in everything. So
Right.
it's really just probably changing the narrative. That's not my strong suit. That's not where I shine. So
Okay.
where do I shine? So and sometimes failure is what leads to success in the end. Like you have to fail, or persevere, or be consistent, or be unrelenting to get the things that you want. And I think that that is what a lot of really big business people have really tried to give to the people who fail and give up. Or that it's a numbers game in sales. Like if a person is in sales and they get like 5 no's and they're defeated, but if they just went that 6th time or waited for that 6th client or
Right.
6th call, if they're in a call center, you know, that it'll come around. And just having endurance and maybe your life circumstances really determined for a long time before you make a choice what your endurance level was. And you have to
Sure.
really work. And it's just like in sports too. And it's just like in your martial arts that you do is that you don't get good overnight. You have to practice and you have to fail a lot of times
Right.
before you get good.
Oh, yeah. Well, and you know, like if we're just good at everything, nothing tells the brain that something needs to change.
Yeah.
You know? And so when we make mistakes, that does signal the brain and say, okay, we need to change something here.
Yeah.
And those are our opportunities for learning.
Yeah.
But if we don't take those, if we quit,
Yeah, true
you
story.
know, which is what so many people do in like
Yeah.
math, you know, and they just quit. And I used to be one of those people. So because it really started coming out, I was identified as a gifted kid, right? When I was young.
Shocking. I'm so
And-
shocked.
Right.
This brilliant human sitting in front of me. Gifted. Who knew?
But wait, it gets better.
It gets better. But wait, there's more.
Yeah, because I got to 7th or 8th grade, you know, and I think it was 7th grade when it started, and I just was not understanding math at all. And
Interesting.
all I heard was, "Come on, LeeAnn, we know you're not trying. Come on, LeeAnn, we know you're smart. You know, come on, LeeAnn." And at that age and that time in my life, I did not have the words to say. He might as well be speaking Russian up there because I don't understand any
Right.
of that. And then over the years, I actually, this is funny, you'll like this. I didn't even realize that I had ADHD until I was in grad school. And
girl,
I had
later.
an internship at the academic athletics office.
Yeah.
And you have to do a project when you have that. And I decided to do mine on ADHD.
Shut the front door. Shut the front
And
door.
I was like doing this project because I don't specialize in ADHD.
Right.
Okay. But
You're like, I just have it. I don't specialize in it.
yeah.
I recognize it a mile away. However,
And yeah,
not my specialty.
well, and there's a lot of that goes on as a therapist. We need to be able to recognize things,
Yeah.
but we don't have to be able to know how to treat them all.
Sure.
But we have to be able to help you find some,
Sure.
way to go get that treated. But anyway, I'm doing this project, and I'm like, that sounds really familiar, and that does too. And and as I was doing that, but I was also putting coping skills with it.
Yeah.
Right? And
feel that.
And so I began utilizing those coping strategies for myself because at one point, I had already decided to go back to school. Let me start over. First time around, I studied music. I have a degree in music performance, okay?
Love it.
And but there's not a whole lot of math in that. You have to be able to count,
Yeah.
but not usually past 16.
Yeah. I wouldn't even know that, and I love music.
And oftentimes not even that high. Like, so
Newsflash.
it's in 4/4. So, but anyway, so I avoided math that entire degree, and I had to take one class, and I could either take math or logic. So, I took this philosophy class. Turned out that wasn't really different, but I started getting it after a while because now I was no longer quitting on
Yeah.
it. Before I would quit, I would
Because
get
it would be
frustrated and
so
quit.
frustrating and so overwhelming that you would just quit because you didn't know how to articulate like, hey, I'm struggling with this because I don't understand it and I need
Right.
more help.
Right.
So I think that's why I call myself an asshole, because in order to get grounded in something or in order to learn something, I have to ask a lot of questions, or I have to be comfortable being uncomfortable telling you that I don't understand something, or can you repeat that? It's not sinking
Yes.
in. Like, I have this problem even at work right now. So, for example,
Do you?
yes. So, literally, I joined a new brokerage and they do things differently. So, then I have to find my way. So, I download the templates they create. And guess what? There is one document that has two different names. So, the one name happened to be at the top.
Okay.
And the correct document I needed, which was the technical term, all the way at the bottom.
Oh.
Okay, ADHD people, I
Okay.
see what I need right here.
Right.
Why am I going to look at the bottom for something
I
else?
would never make it
Even
to
though
the
I
bottom
went
of
into the
that page.
document, I'm like, this is not the right document. I went to my brokers, and the broker was like, yeah, that's not the right document. I went to this other agent, and I'm like, hey, like, this is what's in there. And she's like, can I call you? Because I was like, she said something to me, and I go, I'm not stupid. Like, this is how I talk to people. And Tim's like, you need to put a filter on your text messages. And I was like, no, I don't, because I know I'm the problem and I need them to know that I'm the problem so they will help me. Because I am not saying that they're the problem. I'm just saying there is a problem. It could be me. It could be you. It could be the system, but we got to find the problem because I need systems.
Okay.
Like, that's one thing I've identified in my
I
life.
function on systems.
I function on systems. If I don't have them, I freak out. And it's only because I only have so much mental energy and I don't need to make decisions about every freaking thing. So systems help me automate.
Yes.
So lo and behold, I get on the phone with her and I was like, I just don't understand why this listing agreement, blah, blah, blah. And she was like, oh my God, I didn't even see that document. This is the exclusive right to sell down here at the bottom. I was like, oh, okay. So we're both understanding why we can't figure things out now because you're down here and I'm up here and this is wrong and this is right. And I wasn't in the right place because I didn't know because I went to this place. And she's like, I didn't even know that was in there.
Right.
So I was the problem. I was uncomfortable being uncomfortable. No, I was comfortable being uncomfortable, to say. But like when you were talking about the math, like maybe if, you had been through enough, sorry, that bothered me, like to know, then you would have been like, I need you to explain this more. Or I need you to explain it this way. And then maybe you would have been good at math. Who knows?
So, well, you just described, if you were in my junior year of music theory, I owe you an apology, but honestly, I'm sorry, but not sorry.
Sorry, not sorry.
Because when you're in those classes, you kind of go together through a cohort, so everybody knows each other, and they're smaller classes. And so, I'm in this class, and music theory can be very complicated. Okay?
Yeah, no, thank you.
And, my teacher, Dr. Stuffa, he's up there, explaining it all to us, and we're all like, okay, and it's complicated. And then I'm like, after everything. And what
good
I
for
was
you.
doing, I wasn't even saying something different or asking a question, I was restating it to him in the way that I understood it, which wasn't necessarily the way he said it. And there were times people in my class would be like, LeeAnn, please don't say anything. I understand it. And I would go, I'm going to have to ask you not to listen. Okay. And so.
Because you would confuse them?
Yes. And it would confuse, because they got it, and then they're like, oh no, if I hear more, it's going to confuse me. And I'm going to say it a different way. Right. And so my teacher got to the point where he would go, okay, does everybody understand
Except
that,
for LeeAnn?
He just I didn't even have to raise my hand anymore. And, but this was also my teacher who, called me a creative weirdo. And I was like, that is the best compliment I've ever gotten. Thank you.
See, I love that. I would be like, yes, thank you.
But who were people calling, their senior year in theory going, what'd you get in measure 118, LeeAnn? And because I understood it, but I had to do that for myself because looking back, that was me figuring out how I learned.
Yeah.
And I learn a little bit differently than other people. And that's okay.
Yeah, and everybody needs to be comfortable with the fact that they might learn a little different.
Right.
And they need to be comfortable to get the help, just like they may need a therapist and they're in denial and they need to find someone because it will only make you better.
Oh, yeah.
It will only make you better.
Hopefully.
I mean, not to say that you won't go through some shit and work through your shit, but then you will be better on the other end. So you came out of music theory and went into therapy, and you are an amazing therapist.
Oh,
Tell me real quick, how many years you've been a therapist?
Let's see. I started being a therapist in 2002.
All right.
We're in
So a
2025.
long time.
So 23.
Awesome. And then you started, I want to talk about this amazing concept that she had, since she's telling you how she's, very smart and gifted. She came up with this amazing program to help people enjoy martial arts while also dealing with their trauma or not being triggered by their trauma while being able to experience an empowering sport that most people, maybe could get into it, and then the all that crazy stuff might just trigger them.
Right. That's exactly
You know
right.
what I mean?
You're right. I'm laughing, but you're right.
No, it's true. so all of a sudden they're like, oh my gosh, there's a lot of aggressive sounds and body movements and punching and kicking.
Yeah, I was going to say, if you think about it, we punch and kick each other,
Yeah.
So
See, to me, that sounds awesome.
Yeah.
Because those are the things as a child I wanted to do and I never did. So for me, I'm like, yes,
I can arrange
that. I know. I'm so ready. I'm going to take her class. So she created TIMA, which is trauma-informed martial arts.
Right.
Right?
Yeah.
And so I have been talking to her about taking this class because, I do have PTSD, not probably the kind that would be triggered, but more empowered by martial arts because it would make me feel safe. So then for me, it would work in a different way. I wouldn't have to be necessarily trauma-informed, but it would be a safe space to learn martial arts and an empowering environment. With someone who is mindful to mental health and also this incredible disciplined practice. And she's been doing that for how long? The martial arts piece.
It's been years. I started as a teenager, and then...
Oh, that's right. You did tell me that as a teenager.
I started as a teenager. I started in a different area. I started in Taekwondo, and then I did that for several years, and eventually I stopped, and I took a long hiatus there, I guess. And then when my daughters were young, I returned. Nice. And so, because we had them in martial arts. And
okay.
So since my return, I've been there 14, 15 years, I think.
That's amazing.
So altogether, it's probably 20 years. I've never really counted it all up. But
so when you started back again into it, was it easier because you had a history in it or no?
Oh, yeah. It was easier because I had
like
some
exercising the
experience.
muscle.
Yeah. Although every now the moves are a little bit different. We do different things with our hands, and Taekwondo is more like 70% your feet, 30% your hands, and Matado's more structure. It's more based on self-defense moves, and so we use our hands and feet a lot. It's probably, I don't know what the percentage is, maybe 50-50. So,
what is your experience when you think about Matado? If you just sit here and someone says that, what does your body do? Because when I hear it, I get excited. I'm kind of like, oh, I want to learn that. Oh, I want to do that. I get an actual visceral body reaction. Yes, that would be so amazing.
Sure. Yeah. Well, I think I noticed myself get taller,
Yeah.
and the confidence kind of I feel it inside of me.
Yeah.
So, yeah.
Yeah, I don't know. There's just always something about it that has been like something that I have been very curious about. And I don't know. I just think it's meant to be. I definitely think when Ben was taking it, I felt like that would be something that I would want to do. And also it would push me outside my comfort zone because I tend to be concerned with what other people think. Other people think about me when I do things. So like if I'm like trying to learn something new and I'm doing something, I'm always thinking, oh, they probably think that's terrible. I'm like having that negative inside talk, right?
Yeah.
You know, and it's so dumb.
You know what I say?
What?
Mess up big, girl. Just mess up big. That's what I do. And in fact, I had a musician compliment me on that once. He was like, LeeAnn, you don't mess up a lot, but when you do, man, I really like you do it big. And I'm like, I sure do.
Well, I'm a go big or go home kind of
Yeah.
girl. So you know what? That's some good advice. That
So-
speaks to my soul. So
Well, you know, one time when I was a color belt still, so I would have been disqualified for this as a black belt, but I was a color belt and I was in a tournament and I was competing in bow staff and I turned around, you know, during my form and I hooked the ring rope and I knocked the ring down, right? But I kept going. Now, again, as a black belt, I would have been disqualified for that, okay? But I kept going, and actually I lost I didn't know where I was in the form because it shook me a little bit,
Yeah.
but I just kept going and I kept doing stuff, and then my brain caught up and went, oh, you're here. And so I continued on with it, and I finished my form. And so then, you know, we're standing on the line in the back and they're calling the places and they call third place and they call second place. And I'm like, oh man, I didn't medal. Like, I just didn't medal. And I actually won first place. And the judge told me, I know. I was like, what? You know, like I just knocked the ring rope
I like
down.
little goosebumps in the back of my head, like a little.
And the judge said to me, she was like, you know what? You didn't let it rattle you, and you kept going, and your moves were strong and dynamic, and you kept that up, even though you had, you know, this fumble. And and so that was really cool. Now, again, I would have been disqualified as a
Right.
black belt, but at color belts, it's a little bit easier, you know. Well,
Yeah.
I don't know. We account
A little
for the
more
level,
grace, or,
right?
yeah,
we
the
account
level.
for your ability and the level you are. So,
And how many levels are there?
oh gosh.
I really don't know. I have no clue.
8, I believe. Well, actually, that's not true. That's just going through the color belt
Oh,
ranking.
okay.
And then
But
once
there's like sub rankings within your colors too, right? Like you get one level inside yellow and then 2 levels inside yellow, or no? Is that just for kids?
well, we do use stripe belts in
Yeah.
between sometimes. You know, we don't do that
Is that for adults?
we don't do that as much in the adult program.
just for the kids, really.
Because the testing and the curriculum is a bit different. But then once you achieve a black belt, really your journey's just beginning. And
Really?
you don't understand that at first when you're a new black belt.
Do you think you arrived?
Yeah, you do. And
I was like, because I feel like that's like, hi, I've
then-
arrived. I'm a black belt.
yes, and then some other black belt goes, and now it's just starting, and you're like, what? And then you realize what it is, and so now you're working on perfecting things a bit more, and continuing your journey, and you get this deeper understanding of what it is you're doing, and you know you can then move up through degrees of black belt. So, and one thing that Mike Franzen, who is the founder of Marudo, right? He always says, you know, it's always evolving.
I love
So,
that. That's like my
always
motto in
evolving.
life. You should always be evolving. You should always be evolving and growing. And if that is not on your to-do list, then I feel like you're just kind of doing life wrong in my opinion.
Right.
Come at me. Don't care.
Yeah. So,
I mean, that's the whole point of life. Like, what's the purpose if you're not going to try to do better, be better every day than you were before?
Right.
To me, I just don't get it. Like, what's the purpose? But I think people just get really trapped in a mindset, a culture. I don't know.
I think one of the saddest things that happens as a therapist for me is sometimes people are in my office and I'll say, what's your dream? And they don't have one because no one's ever encouraged them to have one, you know? And
Oh, God.
I know.
That is so, you know what? But think about it. I mean, did your parents encourage you to have a dream?
They totally did.
See, my parents didn't have a dream, I don't think. They just did what they thought you were supposed to do, which is get married. So you fall in love, you get married, you have kids, and you raise your family.
That's what a lot of people do.
So when I was little, I remember, because they always had me in church, I roll, because I you know how I feel about church. sorry, churchy people.
It's okay.
It's good for you. It's not good for me. But I wanted to be a missionary. And I remember of all the churchy people in the whole entire world, me telling my dad I wanted to be a missionary. And he was like, well, Tiffany, you need to get a job where you're going to make money.
Oh,
So to me, that's dream killing.
Yep.
Love you, Dad, but that was dream killing.
Yes.
And there's no hate, no nothing,
Right.
because I really don't want to be a missionary. But, who knew? I think it was just I like helping people.
Yeah.
In general, I love to help people. And that was just the only way at that time I knew how to manifest that type of dream. But I have never thought about it. I always was the one dreaming, but no one told me to. No one ever encouraged the aspirations. I always had to create them myself. That's why I'm a think tank. Like,
well, some of us are natural dreamers, and some of us are natural, like get things done galvanizers.
But I'm kind of both.
Well, that's
I'm a
okay.
weirdo. Like,
That's okay.
Welcome to the weirdo.
Weirdo's good.
I know. I love being weirdo.
I'm in the club.
I always tell people I'm like the weirdest person you're ever going to meet, because not like it's uncomfortable, but like I'm the only person who's like, go, 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 drive, 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 do it right, damn it. But if you mess up, I'm going to exercise a lot of grace for you, but maybe not for myself. And we're going to have fun doing it, which is like an enigma. Like,
Yeah. Well, I don't know. We're kind of a lot alike.
I know, but I find those people. I feel like I attract these type of people in my life because we need our tribe.
We do.
I've been looking for my tribe. Thank you for coming, LeeAnn. Thank you for coming. Now you're never leaving.
My best friend is always like, LeeAnn, do you ever sit down? And I'm like, no.
When you sit down, do you have like self-guilt talk? Like, I shouldn't be doing this?
Sometimes.
Yeah. What is that?
That's how we constantly feel in our society that we have to be productive. And we don't allow for, sometimes resting is productive. But actually, I have a little bit of hyperactivity there going on.
I can't even sit still. Look at me. I'm always sitting here and I'm always moving in my chair.
Yeah.
I watch myself in editing and I'm like, I'm fidgeting.
Yeah.
That's got to be really annoying.
So
Sorry for you.
they're getting into double.
I used to sit at work when I did like phone sales and I had like a ball. So you would see me across this call center, boing, 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 because I was on an exercise ball.
Yeah.
Could you imagine how annoying that would be to see on camera?
Like if I did that at therapy, there's no way. I don't think I wouldn't be very successful because people
would be bonkers.
Yeah.
But how do you deal with your fidgets while you're with people? Because like obviously you're an energy person too. Like
I play with my nails.
Do they hear that? Like this?
I play with them. I play with my cuticles. I push them down.
You are hysterical.
And I've often wondered, if people notice me doing that. Sometimes I just go, I'm just over here playing with my nails. You go ahead.
Because you can't like fidget pop and you can't.
Right. Well, I do have fidgets in my room. I have fidget spinners and I have.
Do you have those for like patients too?
Yeah.
My son couldn't go to therapy without them.
Yeah.
That was like the whole highlight. He wasn't going to talk to you if he didn't have anything to busy his hands. And to feel like he wasn't going to talk to you because he like literally hated therapy, even though it was so good for him.
Yeah.
He just hated going because he didn't want to sit in a room and talk to people. He doesn't like to talk about his feelings. And he doesn't like to just, be in a room.
Right.
And she was a great therapist. I mean, she was super sweet, but it's kind of fun. Do you only deal with adults?
I do now. I did treat kids in the past. I did also do family and couples therapy. And now I'm just at the point where I treat 18 and older.
Smart.
And I do have, though, kind of this small group. Well, they don't know each other, so, but I have this small group of younger people. I think my youngest person is 11. He might be 12 now. But and they're growing up with me. Aww. And I think that's one of the coolest things as a therapist. I get to, I've started with some people when they were in middle school and now they're in graduate school. Or, one of my patients said a while back, she was like, after I graduate high school, LeeAnn, I'm going to move to Florida. So we're going to have to figure this out. And because I was like, well, I can't practice in Florida. I don't
You're
have
like,
a
sorry,
license
friend,
there.
can't do that.
And, but so we agreed we'd figure that out, So with telehealth now, so many things are possible, but you still can't practice in a state where you don't have a license.
Right, exactly. Yeah, I can't imagine how COVID has changed the whole scene of everything.
It has.
So I kind of squirreled, but also we squirreled together when I asked you about, your history with the martial arts, but the TEMA started, when was that it started again?
So I started TEMA just a few years ago in 2022.
Okay.
And, obviously first it was a concept. I was looking back at, the more you study, I mean, I continuously study about trauma, right?
Right.
I'm never going to know everything about it. And again, everything evolves, and shouldn't I,
Absolutely, girl.
And with everything, I mean.
Word.
Yeah. So, but as I'm, looking at the mind-body connection that we have to make during recovery period, I guess, from trauma, I'm looking at how that happened for me, because I do have childhood trauma, and I've done a lot of work on that, and I started reflecting on that and going, how did this happen for you, LeeAnn? And it happens for me a lot through music. It has happened for me a lot through martial arts. And then I also started seeing, periodically we'll have somebody who comes into the martial arts school, and they're coming in because something traumatic has happened to them. And they want to learn how to protect themselves. And they usually only stay for a class or two. And then we don't see them anymore. And I was going like, what's happening here? And
You were really tuned in, interestingly enough. I feel like ADHD people can be tuned in, but also as a therapist, you were picking up some need in the community, sounds like.
We weren't able to talk to them, because they didn't come back. So, and I thought, okay, if you look at martial arts, I mean, it's contact sport, right?
Yeah.
So, and like you said, we're throwing kicks and punches at each other. It triggers that fight or flight naturally. You don't have to have trauma. Everybody has the fight or flight,
Can you get trapped in that fight or flight?
Oh my gosh, yes.
While you maybe don't have trauma, or do you only get trapped?
Oh, well, you don't have trauma. No, not usually.
Okay, so fight or flight usually comes and you get trapped in there because something traumatic, whatever it was, can cause you to habitually live there until you recognize it.
Can. And learn to do something about it. That's where, again, those coping strategies come in. But that's also where the trauma-informed martial arts program comes in, because I wanted to develop something to help people recover. And so that mind-body connection really needs to happen. And it doesn't always happen when you're sitting in a chair in therapy.
Oh, yeah, for
we
sure.
have to do some kind of movement. When we experience trauma, it can break us down literally at the cellular level, okay? Movement, exercise, that's what gets that rebuilding and strong again, So
I kind of love that, actually.
do you?
Yeah.
So, and martial arts is one way to do that. I mean, there's trauma-informed yoga. The other thing I want to say about trauma-informed martial arts is you do have to watch. Not everybody quite understands the concept of being trauma-informed. And I was working with another martial artist and who is way far away and states far away and and stuff, and he was telling me about one of his classes and said, he had a student who was saying, what if I go into fight or flight? And he looked at her and said, just let it happen. And every single person that I've told that to who has trauma goes, no, no, and that was what I thought too. Why? No, that's not what we want to do. We want to try to learn how to manage that and learn how to control that, and not let it take over, right? When we don't need it to. If you have an emergency situation and that needs to take over, even if you have learned to calm your nervous system down, it will still take over, right? Okay, but. I'm sorry.
It's getting both of us. If you need a drink of water, you can take a break.
That's okay. But so in trauma-informed, in my class, what we're going to do is I'm going to be there monitoring you, watching you. You're not going to know that I'm watching out for this stuff, but trust that I am watching out for any kind of signs that tell me you're kind of starting to freak out a little bit, and I'm going to be there to help you co-regulate, de-escalate, whatever it is you need.
I love that.
And I've only had that happen actually once in my class. And they looked at me and they went, LeeAnn, I got to go. And I was like, stay with me here. We're going to calm it down.
I'm not going to let you loose in the world.
Right.
I'm calm.
No, I got you.
Yeah.
And I got every person who comes into that class with me.
Yeah.
And so anyway, she was able to regulate and continue back with class, which was awesome. It wasn't, LeeAnn, I'm going into fight or flight. What do I do? Just let it happen? No, nobody likes that feeling, And so that told me right there that, this other person who thought they were teaching in a trauma-informed way And they had very good intentions,
Sure.
might I say. You know, they wanted to help people, but that's not a trauma-informed way.
Yeah.
And so you really do have to look for, if somebody's advertising that they're trauma informed and they provide trauma informed services, no matter what the services are, do they really understand what the concept of trauma informed
Yeah,
is?
there might be trauma aware, not trauma informed.
Right.
You know what I mean? Like,
Right.
I feel like one comes with care and one comes just with awareness. Awareness doesn't mean a master of it.
Right. Well, being trauma informed, I mean, has, principles that it goes by, and it's building trust and providing a safe environment and making sure that everybody understands and feels safety.
Yeah.
And then, looking at cultural differences or gender differences and things like that. So we have to take all of that into consideration. And there's more to it, but we have to take all of those things into consideration to be able to provide any service in a trauma-informed manner. So...
Well, I can't wait. I would like to do a follow-up once I take the class. So now that I'm finally coming out of the woods into wellness again for the rest of my life.
So, just make it, the class runs 6 weeks.
Yeah.
So make it a 6-week goal.
Yes.
you can stay well.
Because she already
for 6
started
weeks.
one. So I'm going to stay well for like literally the rest of the year. As far as I'm concerned, like, the universe knew I had a very busy year, and it was like, you know what? Let's just get this all out of the way right now.
Maybe so.
Let's boost up that immune system. Let's cause her to get started off on the right foot, even though she didn't know she needed it. And so I'm going to do all the immune boosting things, and I'm going to be well for the rest of the year because lots of amazing things are coming. So then I will get to take your next round of classes. So we're going to have all of your resources that you provided to me, and I have some fun clips to kind of interject and show what it looks like that she provided me, and we'll put her website up because you have your website up and running now.
Yes.
So that you can go check this out.
So I do want to say all those clips, not all of those. Like, I think there's a clip of me breaking, and we don't do all of those things.
No, right.
Okay.
That was you experiencing your martial art journey and her accomplishments, because she's very accomplished. So she was kind of sharing those. So if I share those would probably be early on, talking about your experiences in martial arts, but the team is different, and we have those separated out, and my editor will do an excellent job of putting those things in there. But I think we did really awesome staying on track today and kind of touching base on everything. And I think this is going to just really be one cohesive unit. But once we're done, I'm going to run some my think tank ideas by you.
Okay. That sounds great.
But I'm so glad you came. And
too.
I hope, is there anything that you feel like you didn't get to say that you want to say before I wrap things up?
I think so many people spend time being afraid of managing things that have happened in the past or trying to ignore them. And I just encourage you to get in there, find a good treatment provider, find some kind of, try trauma-informed martial arts out, and try to help yourself heal. You're going to feel so much better. I mean, I feel like yesterday can be really heavy, and sometimes it's just time to set it down.
Yeah. That's funny that you brought that up, because I'm going to bring up something that I think was a really powerful statement that I just read. And I sent it to somebody, and it said, maybe this one is it. Hold on, let me see if this is it. Hopefully it doesn't blast. Nope, that wasn't it. Hold on, stand by while I find it. This one must be it. After realizing you're not healing to be able to handle the trauma, you're healing to be able to handle the joy. I was like,
that's right.
Whoa. Because so many people think that they're healing and doing therapy to be able to handle their trauma, which you do inevitably do by working on it. You're able to acknowledge, cope, all those things. But it's really to teach you how to embrace joy.
Well, what happens is all these symptoms come up when we have trauma. And trauma is really what stays with you. It's not the incident that happened, right? So, it stays with you in these symptoms and intrusive thoughts, nightmares, exaggerated startle response, hypervigilance, all those kind of things. Sometimes physical symptoms, not feeling well, having constant headaches, a compromised immune system, things like that. And so when all of that is going on, right, it impairs our ability to experience the positive things, right?
Yeah.
So
You think you are, but you're not really experiencing them. You can
Right.
say you're doing something, like you can say anything you want. And in theory, saying good things is great. But just because you're like, oh, I'm fine. Oh, I'm better. Oh, I'm not like everybody else. I handled my stuff and
Okay.
X, Y, Z. And you're like, okay, but for real?
you can't know what you don't know. So if you
Right.
haven't felt well for a long time, you've probably forgotten what that feels like.
Right. No
You know?
kidding.
And so having an escalated fight or flight system probably feels normal.
Yeah.
you
It
know?
does. Yeah.
And you live there, and so then now you have all this anxiety, and you just have to manage that every day you're going through life. And sometimes people don't even understand why. So let's
Yeah.
calm all that down so you can experience the goodness in life.
Yeah, exactly. Yeah. Oh my God. See, my brain just starts going boom, 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 boom. And then I start.
Obviously, mine does too, because you're like, do you have one more thing? And I'm like, I have 82 more things to say.
You're like holding my beer. I've got like 18 things locked and loaded. That's literally, and then like every time you say one, I have like another thought. I'm like, oh,
I know this episode's going to go on forever and ever
forever
and
and
People are
ever
gonna be
and
like,
ever and ever and ever. I'm just kidding. No, it's not. But we could always do like little mental health minutes, if we wanted to. That would be kind of fun.
Oh, that would be.
If
I
you,
like
if
that
you were
idea.
game for that.
Yeah, I'm game. Let's do it.
So-
I don't know what it looks like, but let's do it.
Yeah. I mean, I just think it would be nice to have like a little mental health minute, like little mental health check-in, like maybe something positive for the week to work on that anybody in just general could work on.
Well, it's funny that you bring that up because
all right, see?
trauma-informed martial arts, there's a theme for every class.
Oh.
And so, it has something to do with martial arts and something to do with trauma recovery or mental health recovery. Like redirection is one of the themes. And so in martial arts, we have to learn to evade and block, right? So when we block, it's a redirection,
Okay.
And in life, like especially if we've experienced trauma, we get that negative self-talk going. We tend to have lower self-esteem because of the things we're saying in our head, and we have to do the cognitive restructuring. So we have to redirect, right? So we're working on that now, and we talk about that theme every week. We do not discuss traumas in that class. It's strictly a martial arts self-defense class.
smart.
But I do talk about the theme. I talk about it, and we go through like that. So. It's fun.
I feel like
Maybe I'm just a nerd. I don't know.
have I ever told you I love nerds? I literally told my husband that. I'm like, people who say that, I'm like, oh, well, that's why I love you. Because
I love
like
you
I
too.
literally love people's minds. I just get so I'm just a mind person. Like I'll usually find someone like something about their energy, or they're like really smart, or both, or they're fun to be around. All I mean, that's like holy trifecta, right? When you meet people who are like fun to be around, also smart, and also their vibrations are good. I mean, that's like holy crap! I won the lottery there.
There you
know?
go. Yeah. Put that person in your inner circle.
That's right. They say you are the sum of the people you surround yourself with. So it's always good to surround yourself with people that you feel like raise your vibrations when you're with them, and you don't feel like depleted when you leave.
Leveling it up.
That's right,
Yep.
girl. It's like level up, level up.
Yep.
All right. Well, let's wrap this up. Level up, girl.
Okay.
And we'll talk later about the mental health minutes. I'm kind of on this right now. I always do this. I always create some other kind of mini segment within a segment.
That's great. So
It's like
I'm
a kind of
excited
it.
about it. But thanks for having me.
Yeah. Well, thanks for coming and taking time out of your busy schedule to be here. And we'll have more to come.